I am Louisa Latela, a licensed clinical social worker in private practice in New Jersey. I've been doing psychological evaluations for persons considering having weight loss surgery since 2003. Dr. Balsama's staff recently reached out to ask if I would make a brief video answering a few questions so you would better understand why you're required to have pre-op psych eval and what to expect during the visit. I was more than happy to do this. The first question is, what is a licensed clinical social worker? An LCSW is a licensed mental health professional specifically trained to diagnose and treat mental illness and emotional and behavioral disturbances. In order to become an LCSW in the state of New Jersey, you must have a master's degree in social work plus 2,000 postgraduate hours of direct clinical practice working under the supervision of an LCSW. You would then be eligible to take the state licensure test. In order to maintain your license, you must complete 40 hours of continuing education classes every two years. An LCSW can work in an institutional setting and or be in private practice, and their services are generally covered by most insurance companies. In terms of my personal background and its relevance to working with the bariatric surgery population, when I completed my master's degree, I worked at 2 different partial care eating disorder programs which treated persons struggling with anorexia, bulimia, and binge eating. During that time, I was recognized as a top doc for women in eating disorders by Philadelphia Magazine. I have been facilitating group therapy for persons struggling with compulsive eating for nearly 20 years, and I offer both individual and group therapy specifically for pre- and post-bariatric patients. Number 2, why do you need to be cleared for surgery by a mental health professional? Well, number 1, most insurance companies now require a psychological evaluation before they will approve bariatric surgery. Number 2, to confirm that you have a basic understanding of the surgery itself along with its possible risks. You need to realize that this is not something to be taken lightly. This is a major surgery. And many people who are having weight loss surgery have serious health issues like heart disease, diabetes, or sleep apnea, which adds layers of complexity to the surgery itself. Surgery is not the easy way out. It's not like walking into your corner drugstore and buying a diet pill or joining a local weight loss group. This is a life-changing decision. Number 3, we want to ensure that you're aware of the post-operative dietary and behavioral changes that you must make in order to lose your weight and keep it off for good. This requires a high level of awareness and commitment on your part. And number 4, most importantly, a psychological evaluation can help identify potential risk factors, situations in your life that could compromise your ability to follow the post-op eating and lifestyle protocols. If potential challenges are identified, they can be pointed out to you and your treatment team, and appropriate recommendations can be made in an attempt to alleviate or at least minimize their likelihood for interfering with your progress. Recommendations might include additional nutritional counseling, bariatric support group attendance, psychotherapy to address emotional stumbling blocks, or evaluation by a psychiatrist. Your weight loss surgery team wants the best possible outcome for you. By being aware of and addressing red flags before you have surgery, you maximize your likelihood for having a smoother and easier post-operative transition, thus increasing the chances for a long-term successful outcome. Number 3, what are some questions you can be expected to be asked during an evaluation? What is your general mood? Have you ever had thoughts of wanting to harm yourself or someone else? Have you ever attempted suicide? Have you ever been in counseling? Have you noticed any recent changes in your appetite? Do you have difficulty sleeping? Do you have any history of alcohol or drug abuse? Do you have any history of emotional, physical, or sexual abuse? Has anyone in your family ever struggled with alcohol or drug addiction? Has anyone in your family ever struggled with mental illness or committed suicide? You'll be asked some questions about your family of origin. Are your parents or the people who raised you still living? If not, when did they pass? How old were they? What was their cause of death? Do you have any siblings? What is your relationship like with your family of origin? What is your current living arrangement? What are your current life stresses? Why do you want to have surgery? What is your weight history? Have you been overweight your whole life, or is this something that happened later in life? How old were you when you first tried to lose weight? What diets have you tried in the past? Have you ever had an eating disorder? What is your eating like now? How often do you try and lose weight? And how's being overweight affecting your life, physically, mentally, and emotionally? Are you on any medications? How do you think your life will be different after surgery? Which surgery do you want, and why that particular weight loss surgery? Do you know anyone who had the surgery? How have you researched the surgery? Have you attended any weight loss surgery support group meetings? And are you aware of the risks associated with the different weight loss surgeries? Number 4, what can you expect during a visit with me? Well, when you arrive, you'll have a seat in the waiting room. As soon as I am free, I will be out to greet you and walk you back to my office. Appointments are 1 hour, and I start and end on time. My office is comfortable and homey. It's not like a traditional medical doctor's treatment room. You'll have a seat on the sofa, and if you have an insurance with whom I am participating, I'll make a copy of your card. Generally, the first half of the session is dedicated to gathering information. Once I have your basic psychosocial and diet and weight history, I will discuss with you the fact that surgery is not a cure, but rather a tool, a first step in the journey to recovery from obesity. I get calls all the time from people who are 2 and 3 years post-op. They stopped following the bariatric eating protocols and are starting to gain their weight. The common thread among all of them is they did not take the time to understand. They eat when they're stressed, they eat when they're bored, they eat as a way to connect and celebrate with people, and they did not find new ways of dealing with stress or boredom or connecting and celebrating with people. So we will discuss in detail the importance of learning to identify your circumstantial and emotional overeating triggers and developing new self-nurturing ways of responding to those triggers. And I will give you some ideas about how to start doing that right away. I find that people who address their emotional eating issues prior to surgery have an easier time making the psychological adjustments to life after surgery. I'll give you a list of resources where you can find information regarding emotional eating, mindfulness, EFT, and positive thought refocusing. I also talk about the importance of self-love and compassion and encourage you to look at yourself through kind and compassionate eyes. I speak of the importance of having a comprehensive aftercare plan in place and will explain to you exactly what that is. At the end of the session, I will have you sign a release form, giving me permission to send your surgeon a report, and I will collect any payments that are due. And the final question, what if a patient has a history of depression, bulimia, or other eating disorder? How will that impact a clearance? A history of eating disorder or depression does not necessarily disqualify one from being a weight loss surgery candidate, but depending on the severity of symptoms, their history of treatment, and their current living situation, I may recommend that they be evaluated by a psychiatrist and or do some individual counseling to address these issues prior to having the surgery. Bottom line, the goal of a pre-bariatric psychological evaluation is not to pass or fail you, but to ensure that you have the optimal resources available to maximize your chances for a smooth and easy post-operative transition that will support long-term weight loss, thus freeing you to live a happy, healthy, and fulfilling life. I hope this was helpful. If you have any questions or comments, feel free to contact me. You can get my information through the staff at Dr. Balsama's office, or you can visit my website at louisalatela.com. Thanks, and wishing you all the best.